Well, hello, everyone. It's great to quote, see you again, or at least you're seeing us again. I'm Bill Littlejohn and the Senior Officer for Philanthropy at Sharp Healthcare Foundation. I'll have a bit more of an introduction, but it's wonderful to be able to be doing our international conference virtually again, even though we'd love to be in person. It's great to be together to share important information and to be able to stay connected, which is great, connection whatever way we can. And we did a presentation, Erin and I did last year, and on physician engagement and grateful patient programs. And sort of this one is a follow-up somewhat, sort of a part two about next level ally and patient-focused philanthropy in the new normal and the dynamics that we find ourselves in today. At the same time, still practicing traditional philanthropy engagement and with our allies in the healthcare environment, and to elevate our philanthropic programs, no matter what the normal is. And I think there's great lessons and great opportunities for us as we continue to do that and continue to have the impact that we know we want to have going forward, and in the difference that we can make in our philanthropic programs and ultimately in our institutions. So, you know, it's been an incredible couple of years, but it's been a great learning experience for all of us. And I think that learning is only elevating our programs. It's not distracting from them. It's not saying, oh, we can't do this now. I think we're looking to ways that even greater communication, greater connectivity, and greater impact of philanthropy at our organization. So we're really delighted to be able to do that. And so if we want to go to the next slide, or Erin, do you want to say anything first? No, yep. I'll take it from here. So again, what is an ally? The aspect of, you know, I talk about allied relationships a lot, and the aspect of being donor-centric, being ally-centric. The aspect we're going to talk about that allies as physicians, as clinical leaders, as board directors, as executives, those who ally with us in the foundation professionals to be able to implement our philanthropic programs. And what does an ally do, and how do you engage them? It's not what they do in their roles, but what they do with you, and how do you engage them effectively. And I'm going to, my guest today, Dr. Ken Roth, is going to share a lot about that and our working together over many years. And then perspective. So that is that we're very delighted that, and I'll do a more formal introduction of Dr. Ken Roth, you might see in the corner here, who's been an ally for me and Sharp for my entire 20 years. And the perspective of that working together and their perspective of their role in the institution, and also how it relates to the philanthropic program. So a lot of great sharing. Erin's going to share quite a bit about some perspectives, especially from her role with working with many organizations, and I'll certainly share mine from now my 2 decades with Sharp Healthcare. And if you want to go to that next slide, that's me. Pretty nice looking picture there of me from a couple of years ago in front of a great facility that Dr. Ken Roth works in a lot. And I am proud to be the Senior Officer for Philanthropy at Sharp. 23 years now at Sharp, including I'll be starting my 20th year here shortly as the CEO, and I had some 4 years as counsel. So, and that's a real plug in that. You see it's in bold. I have the longest tenure as the foundation CEO, and if I can recommend, stay around if you can. A tenure makes a huge amount of impact and difference, both in your own profession, but those you work with, the institutions work off of strategic and long-term plans. And the longer you can stay to help create the platform for philanthropy and the work that you do that elevates it. It doesn't elevate in 6 months, it might be 6 years, but to be able to be part of that dynamic over time is really, really valuable. I've been very active in AHP, served as chair. I now have 37 years of fundraising, 28 in community hospitals and health systems. So that has been my deal, is just be in and around community hospitals and systems. And another important element, I'm the resident historian at Sharp, which I think is also very important. Philanthropy is about legacy, and the legacy that we create ourselves, but our institutions create. And oftentimes we stand on the shoulders of others, like Dr. Roth and others who come before, to be able to create the legacies of the organization. And so knowing that and being able to tap into that is a real valuable aspect of our roles as well. So it's been an incredible journey for me, and I'm just so delighted to be at Sharp and to be so active in the association, to connect with colleagues like we're doing today. And I think you're up next, Erin.
Yeah.
My colleague, Erin.
Thank you, Bill. So that's me. Hi, guys. I'm Erin Stitzel. I'm a principal consultant with Accordant. I have been with Accordant for 6 years. Prior to joining Accordant, I advanced healthcare philanthropy at Mount Carmel Health System in Columbus, Ohio. Mount Carmel is a part of Trinity Health. And I think I said this last year when we presented, Bill. I started my first Grateful Patient program in 2008 at Mount Carmel under the guidance and direction of Bill and his team, specifically around helping develop. We did our own version of Guardian Angels, and I say, I really developed my passion around grateful patients and physician and clinician engagement at Mount Carmel. And that experience, and with your help and leadership, Bill, was transformational for me and my passion and my career. And then with Accordant, I've really been able to build upon that. I've worked all around the country at 50 hospitals and healthcare systems, developing grateful patient and clinician engagement strategies, and worked with hundreds of physicians and clinicians and nurses. And it's just such an honor to be here with you again, Bill and Dr. Roth, and to share again our insights. So I'm going to go ahead and kick things off. Let's focus on this question: what is an ally? And, I started thinking about what I wanted to say here, and I found this definition, and I really like it. To be an ally is to unite oneself with another to promote a common interest. People who are our allies, they're not just helpers, but we have that common interest and that desire to help. And in that alliance, both parties stand to benefit from a bond or connection that they share. And so we think about our allies in healthcare philanthropy. Allies are so important. We know we can't do our job alone. And so when we think about our allies in healthcare philanthropy, who are those folks that really share our passion around advancing our mission? And two, who are those who share that passion for raising funds to help our missions? But also, who are those that believe, like us, that giving and philanthropy is a joy for folks to connect their passion and purpose around making a difference in the community? And so again, allies are so important because, like I just said, we can't do this alone. And so this was a study that was published a decade ago by AHP that really examined allies and major gift officers, and what's the impact allies have on major gift officers' ability to raise funds. And you'll see here, this first line of this chart, foundation identified prospects. That's our prospects that we would find on our own as philanthropy officers. You'll see the lead time to close a gift was around 6 months. That average gift was $49,000. We look at our board identified prospects. See here, a lead time of around 7 months to close a gift. That average gift went way up to $242,000. But we see here our physician identified prospects. Looking at that, that lead time decreased by half to just under 3 months, but the gift amount increased almost double to $455,000. I'll never forget reading this study. I remember I was a major gift officer at the time, thinking, why have I been doing this alone? And I wasn't. None of us can do this alone. But this study really put an emphasis on just the importance of being very strategic around engaging allies to really help us identify and cultivate our prospects. So how do we identify our allies? And so, I have this picture, of this rock star here. And I'll tell you, so Bill and I, we've talked a lot about, how things have changed, and we've got to look at how things are changing in healthcare philanthropy. And so I say, we used to, when we thought about, okay, let's identify our physician and clinician allies, who are those rock stars? However, today things have changed. Our world is different, and we've got to look beyond that and be very strategic in who we are purposefully engaging to be our allies. And so, one of the things we're going to talk about, which I was actually going to speak about, again, I work with many physicians, but we've got Dr. Roth here. So one of the things we're going to examine later is the world of today's physician, and how your world as a physician has changed, Dr. Roth, and how it's changed to be a physician. And so that's really important, I think, as we as professionals and colleagues looks to engage you and work with you in your time, and how your world has changed, and how we as philanthropy executives and philanthropy officers, we need to be aware of that to really be able to engage you. But second of all, one of the things that I have seen, one of the things that I really want to share as my perspective, very much importantly, is just how the role of caring for patients has changed. You'll see here on this chart, the increase of advanced practice providers, increase in nurse practitioners, increase in physician assistants, and how these advanced practice providers are really working around our physicians to care for our patients, to care for these grateful patients and families. And so that's really important. What I have seen over, especially in the past year, is really I've seen working with our physicians, how we're really bringing in the folks around our physicians and engaging them as well, because they're taking care of our patients as well. One of the things I always like to ask when I'm working with clients and when I'm working with physicians is, when and where are patients expressing gratitude? So many times, for example, I've said this example several times, gosh, in the past few months, I was meeting with an interventional cardiologist, and, he sees a lot of heart attack patients. And he said to me, he's like, well, my patients are so grateful. However, many times they're expressing gratitude later, when they're feeling better during their follow-up appointment. But then he said to me something that's so important to realize. He said, many times my patients, their follow-up appointment will be with their nurse practitioner, so I may not see them again. And that's hugely important to think about when we're thinking about engaging our allies and our physicians and clinicians. So in that example, that physician had said, can we really engage the team around me as well? It's not just about me. We need to engage the folks around me. And so when we think about, for example, I'll meet with so many surgeons, general surgeons, orthopedic surgeons who say, again, my patients aren't really expressing gratitude during their hospital stay. I mean, they're staying in the hospital for shorter and shorter amounts of time, their inpatient stays. It's that expression of gratitude comes later during that follow-up appointment when they're feeling better. However, for example, 2 weeks ago, I was working with pediatric heart transplant surgeons. They told me, gosh, the parents are expressing their gratitude that next day. They're so grateful that their child made it through surgery. And so again, it's really important for us as philanthropy officers and executives to really work with our physicians and clinicians and identify where and when are our patients expressing gratitude. And then we've also got to look at this notion of teams and our teams of clinicians taking care of our patients. One of my clients, we were working with a general surgeon who does a majority, she does a lot of mastectomies, a lot of breast cancer patients. And she said, I really want to pull in my nurse navigator, because my nurse navigator and I were taking care of the same patients, and we could really strategize together and really helping to identify some of our grateful patients and families. So again, that's an example of really looking at those around our physicians and looking at our clinicians and allies and being strategic about who we're engaging. This is a chart we use at Accordant to really help folks kind of nail down how we're going to start by choosing our allies. And again, I'll say, in the past, we really used to, who are our rock stars and our donors and board members, and that's so key. But we've also got to look at where are we raising money at in the organization. And I know Bill and Dr. Roth are going to talk about this later, how, at Sharp, they've been very purposeful about having physician champions in every single one of the funding priorities that they're raising money for. And that's so important because we've got to have, first of all, we're asking our physicians for their time. And so they've got to be passionate about what we're raising money for. But we've got to have viable funding priorities to point our donors to and to point our physician allies to say, this is what we're working together to raise money for. And especially, we've all got limited time and resources. And so when it comes to looking at who our allies going to be, let's start with those allies who are very integral in those funding priorities that we're actively raising money for. This is one of my favorite examples. So this is Dr. Mehta. He is in Louisville, Kentucky. We're working with an organization there, and he's an orthopedic surgeon. And, he had admittedly, he practices in a more rural area. His practice is, not right there in the city. And, he wasn't really on the radar of our hospital leadership. It was actually one of his colleagues we talked to who said, oh my gosh, you need to talk to Dr. Mehta. I know he has so many grateful patients. And he just opened up right away, and he had sent me this picture of his patient. He was an Army Ranger who had just retired, and this particular Army Ranger, the Army had given him 7 pins to give out to those folks who were important to him. And he gave one to Dr. Maida because he had helped him cure his knee ailment. I think he did a knee replacement and whatnot. But, you know, this particular physician, he at the time had no idea the foundation that he could really direct his patients to express their gratitude to the foundation. And he was literally almost jumping for joy at the notion of this. And this particular physician has connected the foundation to more grateful patients than I think any other physician champion at this particular organization. And so just to highlight the fact that sometimes our allies, we might not know of them right away, but in talking with others and connecting with his colleagues, we were able to connect with him, and he's been a wonderful partner. And again, I'll say in addition to physicians, you know, let's build relationships with all of our internal allies within our hospitals, our service line leadership, our nursing leadership. One of the organizations I'm working with, 66% of their referrals have actually come from nursing leaders, and their physicians are connecting with so many patients as well. Our patient navigators, just like I've said, child life specialists. One of my clients in Florida, their best referral to date has come from a child life specialist who was working with a family. And so, you know, as healthcare philanthropy executives and officers, I challenge you to really go inside the 4 walls of your hospital and build relationships with all of these internal allies. This is one of my favorite quotes when I say to do that. I always like to say, work until you no longer have to introduce yourself. You know, when you can go up on your patient floor or go into that physician lounge and they know who you are, that's winning in my book. They've really, you know, when you no longer have to say, hey, I'm Erin from the foundation, but you're a true partner, they know you. And so, you know, Bill and Dr. Roth are going to talk a lot about this, but I want to bring up the importance of our C-suite leaders all as our allies, but also as those people that can really help open the doors and introduce us to allies and really help encourage those allies to work with us. At Accordant, we call them our grateful engagement executive sponsors. I've got a job description for this, and you know, if you want to ping me, I'm happy to send that to you. But, you know, these are, find that C-suite leader in your organization who is truly can help open doors for you and can help really be that champion and help encourage partnerships with allies and to really invite the physicians and clinicians to come to the table. And on the flip side, I'll say when engaging our patients, so this is a diagram we use when helping educate our physicians and nurses, but truly, you know, when we think about the notion of grateful patient, you know, our patients, they're going to express gratitude in one of many ways. Many are going to make gifts, but they also want to share their stories. They want to become volunteers and give us hugs and bring in food. And so when we think about engaging our patients, then we can then take those stories that our patients are sharing and take those stories about those volunteer opportunities and bring them back to our physicians and our clinician allies to really show that, you know, we are raising money, but our grateful patients are also expressing gratitude, and we want to share that with you. Many times we'll often refer to our philanthropy officers as gratitude navigators. You know, we know our patients are expressing gratitude at the bedside, and if our physicians and clinicians can connect us with them, we can be that gratitude navigator to really help explore with that patient how they want to express gratitude in a way that's meaningful to them. So lastly, before I turn it over to Bill and Dr. Roth, I just want to say, you know, when it comes to building relationships with our allies, we've got to really build true relationships. And Bill's going to touch on this a lot more, very much go deeper into this than I will. But I've got kind of this picture of this man holding his hand out. You know, if we look at our allies, specific, you know, our physician, clinician allies, but really any of our allies as it just kind of, please give me a referral, or please, I need this from you, we're going to fail. Because again, looking back to our definition of an ally, and I've got this last sentence, you know, in an alliance, both parties stand to benefit from a bond or a connection they share. This is a two-way street. This is a two-way, trusting, mutual beneficial relationship that we've got to work on together. And so that being said, I'm going to turn it over to Bill and Dr. Roth to expand upon this notion further of how do we really engage our allies into true partnerships to have those true connections.
Thanks, Erin. That was a great job. Really great perspective, the big picture perspective, which is what is great. Dr. Roth and I are going to now drill down to the Sharp experience of what we've been doing together for many years, but some of the key aspects. So I'm going to introduce Ken. I'm going to let him just say a few words to start with, because I know he made a few notes there. Dr. Ken Roth is an incredible physician and leader at Sharp Healthcare, has been for decades, and talk about the perfect ally. Dr. Roth has been a chief of staff at our flagship hospital. He's been chair of the board of the Sharp Healthcare Foundation and is now an emeritus director. He's served on the Sharp Healthcare board. He has been president of the independent practice group that he's part of, Sharp Community Medical Group, which is up to nearly 1,000 physicians. He's served on many committees. He has been a generous donor. He has referred. He's done all the things. He's sort of pushed all the buttons. But more than anything else he has done, he has influenced others. He's influenced lay board directors, executives, patients and families, colleagues. And I think that's that alliance dynamic. So Ken, thanks for joining us today. I know you always have a pretty busy schedule. Anything you want to share to start with?
No, thank you for the kind introduction, Bill. I do appreciate it. I like the word ally. Ally is how do we align? And how do we see, to Erin's point, how do we find commonality? And particularly in the post-COVID era, being part of a team and being focused on a common mission is something that I think after a year and a half, people are hungry for. So I know there's been a lot of antipathy, the politics, everything that's taken place in the world in the last year and a half. I just held a board educational retreat, and I had 120 physicians attend this last weekend. I can't tell you how excited people were to be with other people. And everybody in philanthropy, you've said it a couple of times, you're storytellers. You like to tell stories. You know the history, and you tie people in to the organization through the history. People are very hungry for that right now. So in the post-COVID era, I'm very excited about the opportunities. And I think, our community is really embracing healthcare, who've helped them, who've been the firefighters in 9/11, who've rushed in to help care for COVID patients. I think in philanthropy, this offers us a special opportunity in the years ahead.
That's super, Ken. Now, you this slide here, you see, I'm going to make a few comments about this, about what's important, I think, for all of us as we think about developing those ally engagement is understanding your organization, ergo why I'm the resident historian. If you look on the left-hand side, Sharp has quite a complex organization, including with its physicians, and Ken knows that as well as anyone. We have a large, we have 3,000 physicians. At Sharp, about 1,800 or so in the core, the most active ones. We have a large foundation model group of 600 physicians called Sharp Resealy. And actually, we have a great philanthropy leader that's on the board of directors there. And he is engaging his physician colleagues, really doing a great job of getting them engaged in philanthropy on behalf of the group, but also on behalf of Sharp Healthcare. And then, of course, I mentioned that our large IPA model group, that's where Ken has been president. And we have our hospital-based groups. We have hospitalists, and Ken, actually, you can talk about that you now oversee the hospitalists. And again, you talk about that team dynamic. And then we have independent physicians. We have medical directors. Ken knows that one of the most important groups that we would meet with in our philanthropy program is the medical executive committee at the hospital. So yeah, any other thoughts or comments about physician structure, Ken, that's important for all of us in the professional philanthropy world to understand?
Yeah, I do think it's important that whatever organization you're working at, you understand the relationship between your healthcare administrators and your physicians. Sometimes they're aligned and sometimes they're not aligned. And when they're not aligned, you're going to be challenged to try and find physician champions. We're very fortunate, I think, in that Sharp started and engaged the Studer Group back in 2001 and went down this road of the Sharp experience, which really is patient-centered, patient-focused, providing the right care to the right patient at the right time and at the right cost. And I was trying to work with physicians back in 2001 to do this, and I can't tell you what kind of pushback I got. It sounded like a marketing scheme. I mean, a lot of physicians were very skeptical. When the results bore fruit, and physicians can see there was a significant difference coming and attending at a Sharp hospital than some of our neighborhood hospitals. They realized it was the right place to give care for their patients. We want to be the center, not only to care for our patients, but I tell the other physicians I talk to, you want to provide care for your staff and you want to provide care for your family. Is your facility where you're working at the place where you're going to deliver that care? You're going to spend a lifetime working there. You might as well align yourself with the goals of the management, the institution, the foundation. I think, we have Sharp community. Community is our middle name, and I promote keeping healthcare in the community. We have some great physicians in our community. Let's be supportive. Let's make them great. We can make them great by our time, our talent, and our treasure. How many times, and when we talk to physicians about donations, you had that handout before. We're always talking about that, want to give the treasure away. Well, physicians give a lot of their time and a lot of their talent. And I think when you focus on your physicians, start with the time and talent maybe, and ask for the treasure later.
That's and on the right-hand side of this slide, you're exactly that, Ken. These are our strategic goals that Ken knows, our board knows, our leadership knows. We'd like to see 50% of those core MDs engaged in philanthropy, and we're getting close to that. We have hundreds and hundreds. Give, refer, and be a champion. You're exactly right. The time and talent, as well as the giving. And then you're right, we've seen giving grow as a result of engagement, not just sort of going and ask, yeah, because you're a doctor here, please give us money. A third of our foundation board directors are physicians, including Dr. Roth, who served as chair. Our incoming chair of the board is the medical director for the emergency services department at Sharp Memorial Hospital, one of the busiest guys around, but boy, is he a champion. And he has recruited other physicians to the board. So we have great physician engagement at the board level across all boards at Sharp Healthcare. Our physicians are involved in our major clinical initiatives. They're great champions. They help us write the case. They help us articulate. They identify the stories, the grateful patient stories that can be part of the case. We have a lot of physicians asking each other. Ken has done that. He's encouraged his other colleagues to give. Our champion for Sharp Steely, the foundation group, has done an incredible job to where now 60% of those shareholder physicians are now giving every year. And it's his personal engagement. And it's not just sort of doing it because he's supposed to, but he's part of the board. He's part of the ally engagement dynamic. Again, those meetings with the medical executive committee or other section meetings and department meetings and tumor board and the cardiac group, making ourselves present. It's not for a half an hour, but it's 7 minutes that has a great message that we share with and we get feedback from and build that. And of course, we recognize physicians. We start every board meeting with a story of gratitude, inspired story of giving, and it often involves a physician sharing their work. So all of this goes to we understand the organization, and we have these strategic goals of which we share with our allies that engage, but we're never stop doing it. It's not something, oh, we do it, okay, we're done with that. We keep doing that. So we can go on to the next slide. Of course, this is the Cornerstone program, and thanks for the shout out, Erin, about Guardian Angels, and that we're now up to nearly 60,000 Guardian Angel recognitions at Sharp. I don't know, Ken, we can't count as high as Ken has gone. He's way up there in the hundreds now. But think about the impact of that on the culture of the organization and allies and engagement. Just making a 60-second presentation at a nursing station with a nurse or a physician to say thank you and take a picture and repeat that thousands of times. And people realize it's philanthropy that's driving that. It's grateful patients, and people say, I'm just doing my job. But that has become a cornerstone that has allowed us to engage, but it also has done exactly what, Erin, you talked about. It's giving people an opportunity to give back. But we've gone beyond that with our patients in terms of our Friend of the Foundation program and doing that, kind of a special thank you when they're in the hospital. We do the aspect of screening, and Dr. Roth has become an incredible referrer now, and we now have the electronic referral in the Cerner system where people can do that, and that, of course, many of our largest gifts. So, Ken, you've been part of this incredible gratitude program on both aspects of being recognized, but also referring, and that, I think, talk a little bit about the comfort you have of being able to kind of be a referrer and not think that it's just about money, but it's about that aspect of time, talent, and treasure and giving back.
Right, Bill. It's that attitude of gratitude. What is the benefit that Guardian Angels has given us? When you get a letter that a patient has made a donation in your honor, uh, it just touches your heart that you're making a difference in the world. I mean, we have the saying, Tikkun Olam, we want to leave the world a better place than we got here. If every day you touch somebody in a way that's special and they say thank you, there's nothing more rewarding. I mean, and creating a culture of philanthropy, reinforcing the message that this institution works and is funded in many ways by grateful patients. And grateful patients, we're not asking them to give. Many of them want to give back. It fulfills a need in them to be a part of the community, to help, to partner. I had a patient, Bill knows quite well, donated a nice sum of money to Sharp Chula Vista Hospital, not the hospital I work at, but I'm on the board that oversees that hospital. It's quite a ways away, but she had a relationship with the CEO there. And she came to me and said, I've been talking to Pablo. I know Pablo has a project down there. And I said, it's so great to have you as part of the Sharp community, part of the Sharp family. An older woman with no family, a retired professor at a university. She wanted to be connected. And her making a donation, we named the cafeteria. She was into the culinary arts. She's a great cook. We called it Chica's Cafe. So we named this cafe on the top story that overlooks all of San Diego, just a beautiful place. But she put her legacy on that building. And it was a combination of Pablo, the administrator, talking to her, and then her coming and speaking to me. And I just said, it'd be great to partner with you as we make Sharp the premier place to receive healthcare in San Diego County. So, I didn't say anything special. I just tied her in with the organization. But you, at each and every one of your organizations, can find those physicians who can be your fire starters, who are your rainmakers, the people who can give the elevator speeches. And it's your challenge is to identify who each and every one of those individuals are, because there are physicians who do it really good. You have to find them.
Awesome. And that's a simple process of making a gift. It could be a $50 gift that turns into $1 million gift. And in fact, you can get a relationship with a physician who may have worked there for 20 years and now they've been recognized many times, and now you have a new relationship. So right, this is this aspect of strategy of not just having the Grateful Patient Program, but taking advantage of the relationships. You remind me of that. We did a great little reception for Tom Harless, who had retired. He had received over 500 recognitions. We had a wonderful donor who had made a gift in his honor, and we put up a little plaque with a picture of his wife who had passed away, and he cared for her for many years, and it was just touching. And they're going to go on and make another legacy contribution. But it was just the sheer connection of that power of the care connection. So that's another important element of ally engagement, is having a program like this to facilitate that. You can go on to the next slide of that. And I've shared this. This is an old advisory board slide. And look at that. It's 2006. It's 15 years ago, where they surveyed major donors in healthcare. And this goes back to what Erin shared and Ken knows, is that we talk about donor-centric being ally-centric, is that in healthcare, it is incredibly important to have allies engaged. Look at this chart. 75% of the influence of the biggest gift in healthcare doesn't come from Bill Littlejohn. It comes from Ken Roth, and it comes from a board director. It comes from our CEO. And Ken knows that, of people who have been involved. So it's my job to facilitate the relationship with Ken and with our CEO and other board directors to work together with that donor in Chula Vista to help, strategize the plan, to help decide how best to cultivate the relationship. So if we're spending and that's where I spend most of my time, in that ally engagement aspect. And I think if I'm the most proud of at Sharp, not just we've raised a lot of money, which we have and have huge impact, is the relationships I now have with the allies, is that I can call up a Ken and he'll do this for us today. I can call up the Rob Adamson, our cardiac surgeon, and get him on the phone. And, he said, well, I'm a little busy now, but he'll call me back, because he knows the value of the relationship that we can impart. Not that I'm going to ask him for money or go get me somebody. I'm going to say, Rob, here's an opportunity for us to engage this potential prospect. So this is this aspect. The great term allies have the greatest influence. So your job and my job, I really think of it as I have to manage this big program, but I need to engage people, whether it's on the golf course or it's in the patient room or at the nursing station or in a board meeting. So this is really valuable. Any comments, Ken?
No, great. One of the other ways to help move physicians down that road is to present examples where physicians have been patients. I remember one event that we did, we had one of our nephrologists, one of our kidney specialists, became very, very ill, sepsis, ended up in the ICU, and his own kidneys shut down. And he survived that. He was cared for by his colleagues. And he came back and he talked to us as a physician, talking about what it's like to be a patient in our own institution, and to highlight for physicians that at some point in time they will be patients really engages them in the institution. They become much more vested in the future of the institution, the finances of the institution. They want their facility to be there for them when they end up in his shoes. So, again, how strong is that relationship? And again, physicians are so good at telling stories. They, like Bill, I mean, we are storytellers. We have a lot of stories to tell, but it makes us feel good to retell those stories as well.
That's great. Again, I'm good at what I do, but I'm a lot better when I do it with the allies. So last slide I think we have for us, I think we're getting close here to being done, is that, so now actually, Ken, of course, Ken can't go away. He's going to continue to serve in some role. We have a big campaign underway. We've got big projects going on at the campus where Ken works, and it's exciting to see what's happening. But we engage our physicians lots of ways, and actually we now have a committee that we put together that Ken has helped recruit for our big campaign for the Metro physicians, which is our big flagship campus. And there's Joe Belezzo. And so actually the two chairs of this committee, one was a former foundation board chair, and Joe is going to become the foundation board chair. Talk about influence and leverage and connectivity. And that, back to the three roles of this group, is to give, refer, be a champion. They've already recruited about 24 physicians, and they're getting organized. And the idea is those physicians will engage each other. They'll help set up the meetings in the section groups. They'll have the discussion. They'll share. They'll have a Zoom meeting. We'll talk about it. And again, it's not just about them giving to the campaign. They're going to help us refer grateful patients as they're doing today, but they'll become great champions of the case. That's the other great thing that we do, is especially like in board meetings, is share all the great things that we're doing, so that elevator speech that we have, that the aspect, and that, this is sort of the ultimate culmination of the ally engagement, that we all are in this together. So us as professionals working with a group of physicians and executives, I can tell you that the CEO of the hospital and our CEO of our specialty hospitals is very active with this group as well, including, and even our foundation model head, Dr. Mike Martin, has gone to Ken and say, anything I can do to help, because many of those patients from that group end up at the Sharp Memorial Hospital, as Ken knows. And so collaboration, back to that team aspect. And that, just sort of lastly, Ken, just to talk about the aspect of physicians as team, and hospitalists, and the foundation model doctors and specialists, sort of all kind of in this together.
Right. Yeah. Healthcare is evolved in that it's not an individual sport anymore. It's now a team sport. I think Erin kind of highlighted the nurse practitioners, the PAs. We deliver care as a team. I, in my private practice, in my office practice, we have one of the nurse practitioners here has relationships that are stronger than some of the physician relationships. And if you want to engage and have a relationship with the patients of the practice, you can't overlook the advanced practitioners or anybody else who's having those kind of relationships. But again, it's who can tell the story, and what's their ability to speak in a candid, open way to a patient, not to make an ask, but to, again, how can we support one another for the common good of our community?
Great. So as I wrap up, and again, it's about tenure, it's about strategy. We have a plan for engagement, and we have various vehicles for that. We understand our structure. We involve the leadership. we create this great dynamic of allies. We're all in this together. And the end of the day is that when you go to a board meeting at our foundation, it doesn't matter what role you have, you're part of the philanthropy group. We have system board directors there. We have our executives. We have our foundation board. We have emeritus directors and ex officio. We have 50 people in the room. At the time, they're not, it's all based on, this is the aspect that philanthropy is an undergirding, is a foundational element of what we define as excellence at Sharp. And all of us together, working together, will elevate that and take it to the next platform. So, and it's, you know, it's not like it's a 6-month effort. This is a permanent dynamic of which we work to develop and ultimately make us successful. And we've seen that success. And more than anything, I have the gratitude, not just to grateful patients, I have gratitude to the allies like Ken and others who have made this what it is. And I think we're all incredibly proud of that. And that as we look to this big campaign we're doing the same thing we did when I got here 20 years ago, is telling stories, sharing with people, but even today, even in a much broader and more dynamic way than we ever have before. So thanks, Ken, for being part of that. I don't know if Erin, you want to follow up with anything in the final, but
Yeah.
and Ken is not moving anywhere. He is staying right here in San Diego because we're not going to let him go. But I know, Ken, if you and I wanted to have a little Zoom call with folks again sometime, we'd be happy to do that and connect. And so I'm sure some of our other physician colleagues would be more than willing to share their expertise. Ken was on a panel with us at AHP a number of years ago with some of our leaders. So again, thanks, Ken, for all you do.
Well, and I just want to add, you know, obviously, Bill and Dr. Roth and Sharp, I mean, you're the gold standard of this. And I would just share for those of you who don't have that culture yet, who haven't spent that many years developing your ally relationships, I would just share, you know, again, the thing that Bill said, this is not a 6-month effort. This is a permanent integral effort. This is what Bill spends 75% of his time doing. And these relationships take time. Culture building takes time. And, you know, again, we've got to look at the big picture and really just, I always say, you know, let's be organic about it. You know, start building the relationships with your internal allies, and it will grow and blossom. And if you make it a part of your permanent day-to-day work and way of life, you know, I always say, you know, as fundraisers, we need to be out in the community talking to donors. As healthcare philanthropy executives, we also need to be spending just as much time inside the 4 walls of our hospital or in our care settings, as we know healthcare is changing, building strong relationships with our leadership, our nurse practitioners, our physicians, and those allies. That's, to me, that's going to make or break your success. So again, I mean, Bill, you're the gold standard, and it's taken so many years. And if you're just starting out, that's okay. Start and keep going and build those relationships.
Exactly. Create the legacy.
Yep.
So thank you all very much for participating in this. I know we'll be able to provide all the slides and information after the activity. And of course, you know, but Erin and I, we know a lot of you who are on this call, and we'd be happy to follow up with any other information. And I'm sure Dr. Roth would be more than willing to provide his insight in the future as well. So thank you all for participating, and look forward to, hopefully at some point we get to see each other in person. But until then, well, let's stay connected.
Thank you all.
Thank you for having me. Appreciate it.